So there's an issue I'd like to address that I'm honestly not seeing being addressed by, frankly, anybody involved in abortion. Now, here's the thing. Um, Pro-life versus pro-choice is one thing, but the main thing that is not being addressed is the fact that, as my mother always said, and she would know because she went through this, anytime a woman gets pregnant, it is putting their life on the line. A woman who gets pregnant risks their life. And this is why. All right. So, first and foremost, a late term miscarriage, which could happen anytime between, 0 and 12 weeks, but a late term one. So, closely to 12 weeks and then, maybe up to 15 weeks. That sort of miscarriage can lead to hypovolemic anemia, which can lead to death. All right. So basically, a woman who has a late term spontaneous abortion, which is the medical term for a miscarriage, they can bleed to death. All right. So another super common thing is preeclampsia. So hypertension with pregnancy is very common. The fact that there's more mass of the woman and there's more blood flow that needs to get sent to certain areas increases the blood pressure. And that's totally normal and natural. And most women do experience a spike in their blood pressure during gestation. However, it can get to the point at which the woman could end up having life-threatening seizures and or stroke. And this can happen up to 6 weeks after delivery. The other one is gestational diabetes. So when a woman is pregnant, the pancreas has to work overtime. And sometimes that means that they run out of insulin and they develop diabetes, which is resolved with childbirth. But also, again, very serious medical condition that could be life-threatening. Now, let's move on outside of the common stuff, all right, whatever. But then let's go into, like, delivery itself, all right? Delivery is also life-threatening. I personally, myself, almost bled to death having my first child. And that was in a completely controlled situation. I was at the hospital. Obviously, I survived. They did excellent care on me and made sure everything was okay. But then there's so many other complications that can occur during a pregnancy. During a delivery, right? So, just for example, my first child, she passed what's called meconium. So basically, she pooped before she came out, and the problem is with fetal meconium, it's very sticky and tarry. So if they inhale it, it sticks inside their lungs, and that can lead to very serious pneumonia, sepsis, you name it, and they can die from that. So not only at this point are we putting the woman's life on the line, but we're also putting the child's life on the line. So these are just very little subtle examples. And okay, how about this? Child's being born, coming out not head first, needs a C-section. C-section is, I know it's seen as a really casual type of deal, but it is still major surgery, which includes the risk of infection, exposure, fetal death too can occur in a situation in which a C-section is required. So I'm getting very annoyed by the fact that not even the people who are pro-life seem to be acknowledging the health risks and the fact that, this woman, or in some cases, a teenager, a child, could die. So, to sum it all up, with the whole abortion thing, we need to take into consideration the age of the mother. So, if it's a teenager, right off the bat, that is a high-risk pregnancy right there, and that needs medical supervision throughout the entire gestation period. Because a teenager they're developing their own bodies while developing another body inside them. High risk. And then let's think about any sort of medical stuff, maybe pre-existing medical things that are going on, medications women are taking, girls are taking. And so what I'm getting at is that all of those complications to which are referred, think about that being on a 12, 13, 14, 15, whatever, teenage girl who was raped. And now, not only is she scarred for life, but she might not survive being pregnant. And that's all I'm saying. I'm not saying I'm pro-abortion. I'm not saying I'm pro-life. I'm just making it real that, like, women who become pregnant risk their lives